Welcome to Health First. With us today on our program, we have Dr. Silvio Papapietro, who's a cardiologist who's been practicing in Cullman, but now available to offer interventional cardiology here at Cullman Regional Medical Center. Stay tuned to learn more about advanced heart care here in Cullman. We'll be right back. Welcome back to this Health First program where we're talking about advanced heart care here at Cullman Regional Medical Center. Dr. Silvio Papapietro, cardiologist that's been practicing here for many years, is now with us at more extended time providing interventional cardiology. And we want to talk about basic cardiology and interventional cardiology and what that means. But first, as we start out today, tell us a little bit more about yourself and your background and how you got to Cullman.
Good morning, Maria. I'm originally from Chile, that's South America, and I finished medical school in 1972 and came to the United States in 1973. I did my general internal medicine training 3 years, and then I came to UAB to train as a cardiologist in 1976. I stayed at UAB until 1981. I was on the faculty there. Then I went into private practice, mostly at Caraway Hospital in Birmingham.
Okay.
And then went to St. Vincent's. And in 2004, I decided to go back to UAB. So I've been at UAB now for the past 6 years. And during this time, I, also been practicing at Cullman. Part of my assignment with the private practice group that I was before was to come to Cullman. So I've been coming here sort of on a regular basis for the past, I think, 17, 18 years.
Okay, so you're very well known in this area, and I know people have called you Dr. Papa.
Yes, my name is way too long for most Southerners, so Papa is fine.
Okay. Well, we appreciate you sharing more about your background, and we want to talk a little bit more about general cardiology and what you're now providing here in Cullman and what that means to the Cullman community. So when we hear the terms interventional cardiology, can you kind of explain to us what that means?
Well, interventional cardiology is a branch of general cardiology. It's a special training within cardiology, and the main purpose of interventional cardiology is to perform procedures in the heart without having to do a major surgery or opening the chest. So over the past 20 years, this was developed by a German cardiologist called Andreas Grunzig, who basically devised these little wires and balloons and tubes that allow us to actually go from a major artery like the artery in the groin. Mm-hmm. We can go through the artery and go into the heart, into the small arteries in the heart, and we can open up blockages. We can close congenital holes and do a host of things that until 20 or 25 years ago could only be done by surgery.
So you've seen tremendous advancements in this area.
Absolutely. And in that respect, I think the major advances have been from industry, really.
Okay.
I think the industry all over the world has led the advancement because they have developed these wonderful tools that we could only dream of 15 years ago that are now available, almost everywhere.
Well, help us understand exactly what this means now for Cullman area residents. If they're having a heart attack or interventional cardiology that you can perform now here, what does that mean to area residents?
Well, it basically provides a service that was not available. I think that, this service, of course, is available in Birmingham, Huntsville, and now, we can perform procedures that could not be done before. The most common procedure, really, is what is called coronary angioplasty mm-hmm. or stenting that enables us to dilate and correct a blockage in one of the major arteries to the heart. I would like to say also, that the major impact, I think, for this area is not so much for the elective patient that is doing okay, is having a little pain, but the major impact for the Cullman area is for the treatment of heart attacks. Because when the patient is having a heart attack, time is of the essence. There's not much time to drive 60 or 70 miles to go to a place. So by having the technique available here, we can now treat patients with heart attacks locally. We don't have to transfer them anywhere.
Okay. And give us an example. Say someone's called 911 and they've called with chest pain and need immediate attention. Kind of walk us through, if an ambulance was sent to get someone, maybe one of our family members, what would the procedure be if they identified a heart attack in the field, and with all the advancements, what would the process be?
Well, Cullman, I think, is blessed because I understand that the rescue team and the ambulance service are really outstanding. They respond very quickly, and from my experience here, they're extremely well trained. But the principle is if the patient is having symptoms consistent with a heart attack, chest tightness, chest pain, shortness of breath, perspiration, the rescue team will identify this. They have the ability to perform an EKG, an electrocardiogram, on the field and transmit the EKG to the hospital. When the hospital receives the EKG, if the electrocardiogram, that's the EKG, shows a heart attack, then they send a page through our pagers, and they activate the heart team.
Okay.
And that means that within a few minutes we have everything in position to take care of the patient. By the time the patient arrives to the emergency room, the emergency room physicians will do a very quick, targeted evaluation to make sure the patient is breathing well, that the pulse is adequate, that the blood pressure is adequate, and then the patient is quickly, rapidly transported to the cardiac catheterization laboratory. There is a suite where we have all the equipment and the technology to perform an arteriogram that's taking pictures of the arteries to the heart, identify the artery that is causing the heart attack, and try to correct the problem. Time is of the essence here. So we've been working, the hospital has been working for a long time in trying to optimize the response.